There is a moment a lot of senior cat owners describe almost exactly the same way. Their cat, the same cat who has used the same litter box in the same corner for 12 years, suddenly stands in the middle of the hallway at 2 in the morning and cries out, loud, confused, almost distressed, like they do not recognize the house they have lived in their entire life. And the owner's first thought is usually something simple. Maybe they are hungry, maybe something hurts, maybe it is just old age. But sometimes it is something far more specific and far more misunderstood, something called feline cognitive dysfunction, the cat version of dementia. It is more common than most owners realize. It is frequently mistaken for ordinary aging or bad behavior, and the earlier you recognize it, the more you can actually do to slow it down and keep your cat comfortable, oriented and calm for years longer than you might expect. So today, we are walking through exactly what feline cognitive decline actually looks like, the early signs almost everyone misses, and what genuinely helps once you notice them. If you are new here, welcome to Cat Rules, where we take real science and turn it into something you can actually use with the cat curled up next to you right now. Let's get into it. Let's start with what is actually happening inside an aging cat's brain, because understanding the mechanism makes every symptom that follows make a lot more sense. Feline cognitive dysfunction shares some real biological similarities with Alzheimer's disease in humans. As cats age, particularly past roughly 10 to 12 years old, a protein called beta amyloid can begin accumulating in the brain, forming deposits that interfere with normal neural communication. At the same time, blood flow to the brain can gradually decrease, and the brain's own antioxidant defenses become less effective at clearing out cellular damage that builds up over a lifetime. The result is a slow, progressive decline in memory, spatial awareness, learning, and the sleep-wake cycle, not unlike what happens in human dementia patients. Researchers estimate that cognitive dysfunction affects a significant percentage of cats over the age of 10, and that percentage rises sharply the older a cat gets, with some studies suggesting well over half of cats past 15 show at least some measurable signs. And yet, despite how common it is, most owners have never even heard the term, which means most cases go unrecognized until they become severe. So let's talk about the actual signs, because this is where things get genuinely useful. Veterinary behaviorists often use a memory framework built around 5 key categories, and one of the most common ways to remember them is the acronym DISHA: disorientation, changes in social interaction, sleep-wake cycle disruption, house soiling, and changes in activity level. We are going to walk through each one, because recognizing these early is genuinely the difference between catching this in a manageable stage and only noticing once it has progressed significantly. Disorientation is often the first and most alarming sign owners notice, and it is exactly what we described at the start of this video. A cat with cognitive decline may seem lost in spaces they have known for years, staring blankly at walls or into corners, getting stuck behind furniture and unable to figure out how to back out, or appearing confused about where the food bowl, litter box, or door actually is, even though nothing in the environment has changed. Some cats will wander aimlessly through the house, pacing without any clear destination, or stand at the wrong side of a door waiting for it to open. This is not stubbornness or a new bad habit. It is a genuine breakdown in spatial memory and environmental processing, the cat equivalent of a person walking into a room and forgetting why they came in, except happening far more frequently and without the ability to laugh it off and reorient themselves the way a person can. Changes in social interaction come next, and this category can move in either direction, which is part of why it gets missed so often. Some cognitively declining cats become noticeably more clingy and dependent, following their person from room to room, vocalizing when left alone even briefly, or seeking constant physical contact in a way that is a clear departure from their normal independence. Others move the opposite direction, withdrawing from interactions they used to seek out, seeming less interested in play, less responsive to their name, or less engaged with family members and other pets they were previously bonded with. Both of these patterns can reflect the same underlying issue: a brain that is having a harder time processing and predicting the social world around it, which can make ordinary interaction feel more effortful or more necessary depending on the individual cat. The sleep-wake cycle disruption category is one of the most exhausting for owners to live with, and it is often the sign that finally pushes someone to book a vet appointment. Cats with cognitive dysfunction frequently develop what is sometimes called sundowning, a pattern where confusion, restlessness, and vocalization intensify specifically in the evening and overnight hours. This mirrors a well-documented pattern in human dementia patients almost exactly. A cat who slept soundly through the night for a decade may suddenly begin crying loudly at 3 in the morning, pacing the hallway, or seeming distressed and unable to settle, while sleeping more heavily than usual during the day to compensate. This is not your cat being difficult or seeking attention out of boredom. It is a disrupted internal clock, and it is one of the most treatable symptoms on this entire list once properly identified. House soiling in a previously reliable, well-trained cat is often one of the more heartbreaking signs for owners, because it can feel like a betrayal or a regression when it is actually neither. A cognitively declining cat may simply forget the location of the litter box, forget the sequence of steps involved in using it properly, or become disoriented partway through the process and eliminate somewhere nearby instead. It is worth noting here that house soiling always deserves a full veterinary workup before assuming it is purely cognitive, because pain, particularly arthritis, making it physically difficult to climb into a box, and various medical conditions can produce identical symptoms, and ruling those out first is essential before settling on a cognitive explanation. Activity level changes round out the core framework, and this typically shows up as a general decrease in play, exploration, and grooming, alongside an increase in aimless behaviors like repetitive vocalizing, staring at walls, or pacing without purpose. A cat who used to chase a toy across the room for 10 minutes at a time may lose interest after a few seconds, not necessarily because of joint pain, though that should still be checked, but because the sustained attention and goal-directed behavior that play actually requires has become harder for their brain to maintain. It also helps to understand that cognitive decline in cats typically does not appear all at once. It moves through recognizable stages, and knowing roughly where your cat sits can help you understand what to expect next rather than being caught off guard. In the earliest stage, signs are often so subtle they get dismissed entirely. An occasional moment of hesitation before jumping somewhere familiar, a slightly longer pause staring at a wall, one confused night here or there that seems like a fluke. Most owners, understandably, do not think much of these isolated moments, and honestly, at this stage, an isolated moment genuinely might not mean much on its own. What matters is whether these small moments start happening more frequently over weeks and months, rather than staying as rare, one-off occurrences. In the middle stage, the DISHA signs we just covered become more consistent and noticeable: more frequent nighttime vocalizing, more regular disorientation episodes, a clearer pattern of house soiling, or social withdrawal that a family starts actively discussing rather than shrugging off. This is generally the stage where most diagnoses actually happen, because the pattern has become impossible to ignore. But importantly, it is also still a stage where the interventions we are about to cover can make a genuinely meaningful difference in slowing further decline and easing daily symptoms. In the more advanced stage, symptoms become more severe and more constant. Significant disorientation even in completely familiar spaces, substantial sleep disruption, and a noticeable decline in responsiveness to their environment and the people around them. Even at this stage, supportive care, environmental management, and veterinary guidance remain. Valuable for comfort and quality of life, it is simply a different, more intensive kind of care than earlier stages require. The reason this progression matters is simple. Catching your cat in that early or middle stage, rather than waiting until the advanced stage forces the issue, gives you and your vet meaningfully more room to slow things down. There is a phrase that comes up constantly around this topic, and it genuinely does more harm than most owners realize. The idea that a confused, restless, or withdrawn senior cat is simply experiencing normal old age, and nothing can really be done about it. This framing feels intuitive. Cats do slow down as they age, That part is true and expected, but it quietly discourages owners from ever mentioning these changes to a vet, treating them as an inevitable, untreatable part of getting older rather than a specific, identifiable condition with real management options. Normal aging in a cat generally looks like a gradual, gentle slowing down, slightly less jumping, slightly more sleeping, a calmer overall demeanor, without confusion, without disorientation in familiar spaces, and without a disrupted sleep cycle involving nighttime distress. Cognitive dysfunction is not simply an intensified version of that gentle slowing. It is a distinct pattern involving genuine confusion and disorientation, and treating the two as the same thing means potentially treatable. Manageable symptoms go unaddressed for months or years, simply because everyone involved assumed nothing could be done. If you take away only one thing from this section, let it be this: do not let the phrase "just old age" stop you from mentioning a genuinely confusing or distressing change in your senior cat's behavior at their next vet visit, because that conversation costs you nothing and could open up real options you did not know existed. If you are recognizing even one or two of these signs in your own senior cat right now, that does not automatically mean cognitive dysfunction. Plenty of these symptoms overlap with other conditions, which is exactly why a proper veterinary evaluation matters so much here. But it absolutely means it is worth paying closer attention and bringing it up at your next appointment, rather than assuming it is simply old age and nothing can be done. If this kind of practical, science-backed breakdown is useful to you, this is exactly what this channel exists for, so go ahead and subscribe if you have not already, because we cover topics like this every single week, and there is a section coming up about what actually helps that most owners have never heard of. Let's talk about what actually helps, because this is the part that matters most, and there is genuinely more you can do than most owners realize. First, environmental consistency becomes incredibly important for a cognitively declining cat. Avoid rearranging furniture, moving the litter box, or relocating food and water dishes, because a familiar, unchanging layout reduces the disorientation load on a brain that is already struggling to keep up. If you do need to make a change, do it gradually, and consider adding a nightlight near key pathways, the litter box, the food area, since many cognitively declining cats also experience some degree of vision decline alongside the cognitive symptoms, and darkness can dramatically worsen disorientation. Second, routine matters more than almost anything else. Feeding, play, and bedtime at consistent times each day give a declining brain fewer variables to process and predict, which measurably reduces anxiety-related behaviors in cats with cognitive dysfunction. This is one of the simplest interventions available and also one of the most effective, requiring no medication, no special products, just consistency you are probably already close to providing. Third, mental stimulation genuinely appears to help slow progression, not just manage symptoms. This might sound counterintuitive, giving a struggling brain more to do, but research on cognitive aging across species, including humans, consistently shows that appropriate mental engagement helps maintain existing neural pathways longer than inactivity does. For cats, this means simple food puzzles, short, low-pressure play sessions using their strongest remaining senses, often scent and sound rather than fast visual tracking, and continued gentle social interaction rather than assuming a declining cat needs to be left alone and undisturbed. Fourth, diet can play a measurable role. Some veterinary-formulated senior diets include added antioxidants, omega-3 fatty acids, and specific compounds shown in research to support brain health in aging cats. And your vet may recommend a dietary change or supplement specifically targeted at cognitive support, once a diagnosis or even a strong suspicion is on the table. This is genuinely one area where a conversation with your vet can lead to a concrete, actionable change rather than just information to sit with. Fifth, and this one gets overlooked constantly, do not underestimate the value of simply staying calm and predictable yourself during moments of confusion. When a cognitively declining cat is disoriented, crying, or seemingly lost, The instinct is often to rush over with a lot of noise and movement, trying to comfort quickly. But a calm, quiet approach, speaking in a low, familiar tone and gently guiding rather than grabbing, tends to help a confused cat settle far more effectively than an anxious, high-energy response, which can actually compound their distress in the moment. Here is something worth sitting with for a second. If your cat could tell you exactly what a confused 3 in the morning moment feels like from the inside, do you think they would want you rushing in frantic or quietly, steadily there? Now, an important distinction that gets missed constantly, and this one genuinely matters for how you approach any of this. Cognitive decline symptoms overlap heavily with several treatable medical conditions, which means self-diagnosing based on a video like this one, however accurate the information, is never a substitute for an actual veterinary workup. Hyperthyroidism, chronic kidney disease, high blood pressure, and various forms of pain can all produce symptoms that look almost identical to feline cognitive dysfunction: increased vocalization, restlessness, altered sleep patterns, house soiling, and many of these underlying conditions are highly treatable once properly identified, sometimes resolving the apparent cognitive symptoms almost entirely once the actual medical issue is addressed. This is exactly why any senior cat showing these signs needs blood work, a blood pressure check, and a full physical exam before anyone settles on cognitive dysfunction as the explanation. Because treating the wrong underlying cause means missing a window where something else entirely could have been fixed. This overlap between cognitive symptoms and treatable medical emergencies is actually one of the exact reasons we put together our senior and disabled cat emergency guide, because recognizing the difference between ordinary confusion, a genuine medical emergency, and manageable cognitive decline in the middle of the night without a vet immediately available is one of the hardest and most important skills an aging cat's owner can have. It walks through exactly what warrants an emergency visit versus what can wait until morning, and it is linked down in the description if that is something you are navigating right now or want to be prepared for. Let's talk briefly about what a veterinary diagnosis process actually looks like, because a lot of owners avoid bringing this up simply because they are not sure what to expect. Your vet will typically start with a full physical exam and blood work to rule out the treatable conditions we just mentioned: thyroid function, kidney values, blood pressure, and general organ health. If those come back clear, or once they are appropriately managed and the behavioral symptoms persist, your vet may proceed with what is essentially a diagnosis of exclusion for cognitive dysfunction, meaning it becomes the most likely explanation once other causes have been ruled out, since there is no single blood test or scan currently used in general practice that definitively confirms feline cognitive dysfunction the way an MRI might in advanced human dementia research. From there, your vet may discuss dietary changes, environmental adjustments, and in some cases, medication that can help manage anxiety or improve sleep quality, all aimed at maintaining your cat's quality of life for as long as possible, rather than reversing a condition that, currently, cannot be reversed, only managed and slowed. If you are sitting here recognizing your own cat in some of what we have covered today, take a breath, because this is genuinely one of the more manageable chronic conditions a senior cat can face, especially when caught early. Cats with cognitive dysfunction who receive consistent routine, environmental support, appropriate medical management, and a calm, patient owner willing to adjust rather than get frustrated often maintain a good quality of life for a meaningful stretch of time after diagnosis. This is not a hopeless situation, it is a manageable one, and the single biggest factor in how well it is managed is simply how early it gets recognized, which is exactly why we made this video in the first place. Before you go, I want to ask you something. If you have a senior cat, has anything we covered today matched something you noticed but did not have a name for? A confused cry at night, a moment of staring at nothing, a sudden change in the litter box you could not explain? Drop it in the comments, genuinely, because so many senior cat owners feel like they are the only ones dealing with this, And reading through this comment section is often what shows people they are not alone in it, and sometimes points them toward getting an answer they had been putting off for months. If this video helped you understand your cat a little better tonight, that is exactly why we make these. Subscribe if you have not already, because we have a lot more senior cat content coming. The practical kind, built to actually help, not just inform. We will see you in the next one, and give your old friend a little extra patience tonight. They are doing their best with a brain that is working harder than it used to.